Due to a very secret cause, many people are dying suddenly every year. And this secret cause is so mysterious that many people are still affected by it today, but no one will ever know its seriousness. And that's the biggest mistake that millions of Indians are repeating in their daily lives and playing with their lives. You people must be knowing this for sure. In recent years, the number of heart attack cases among young people has been increasing. In fact, today heart attacks have become India's biggest killer, and 1 out of 3 humans is dying today due to heart attacks.
Have you noticed how so many young people in their 20s and 30s are dying from heart attacks? It's a concerning trend.
50% of heart attacks in India occur in people below the age of 50. Why are heart attacks suddenly claiming young lives?
Now, the interesting thing here is that doctors used to mostly consider cholesterol as the primary reason for heart attacks, and their solutions were mostly limited to reducing bad cholesterol and increasing good cholesterol, so that your heart's arteries don't get blocked and you don't have a heart attack. But recently, a research was conducted which revealed a secret group of factors responsible for heart attacks that are beyond just cholesterol and are worth paying attention to and understanding, if it is not treated in time. In this new research, scientists collected samples from blocked arteries of 101 patients. When they tested these samples in their lab, it was found that in 101 patients, 78% of the patients had blocked arteries. Bacteria were discovered to be causing the blockage. Now, the interesting part. It was exactly the same bacteria that was also causing infections in the patient's teeth. It was found that 78% of heart attack patients who had experienced heart attacks had one very common factor. And perhaps that contributed to their heart attacks. They didn't get heart attacks because they were eating oily food, had a bad lifestyle, or stress that caused high cholesterol buildup. Perhaps it was related to the health of their teeth. So does this mean that dental infections in some way are reaching the heart and causing heart attacks? Those bacteria that are affecting your teeth, how are they impacting your heart? I mean, are those bacteria somehow traveling from our mouth to our heart? And the stomach has highly hydrochloric acid, which mostly kills all the bacteria. So then, how is this possible? Now, with these new findings, doctors were rethinking their conclusions. One more mind-blowing observation came from a renowned healthcare company, Mayo Clinic. When they assessed 2005 heart surgery cases, it was found that roughly 1 in every 10 heart patient, the patient who had either died during surgery or had severe complications during the surgery. Those patients just before their surgery had their dental surgery performed. Especially tooth extraction surgery was mentioned in the dental report.
Patients with dental problems have a higher risk of bacteria in the bloodstream, which can lead to an infection on a new heart valve. Infections on artificial heart valves are actually quite serious.
We usually extract tooth when there is infection, and this infection starts spreading, right? After this report, heart doctors became absolutely sure that this is not a coincidence issue. This is a very big gap in the knowledge of medical science, due to which many people's lives are being affected. Because if heart treatments are performed after dental treatments, severe complications are being created. In fact, 78% of heart attack victims have the same bacteria in their heart, which is also present in their teeth. And there is no proper coordination or communication between dentists and heart surgeons. Through this video, today we will try to understand the science, cause, and effect behind this. Try to educate ourselves. And what is the relation between dental health and heart health? Its awareness should reach everyone because that is our aim. Through this channel, Get Set Fly Science, we want personal empowerment with science. Let's start with heart education. General public considers heart attack as the common name for all heart-related ailments. But actually, heart attacks are of different kinds. With the help of this simple animation, we shall understand the different types of heart attacks. Or medically called cardiovascular diseases, how do they actually happen? So look, this is our heart and its surrounding arteries. Now, due to several reasons like these, sometimes plaque or clots form in your arteries, which can block your arteries and hinder the blood supply to the heart. This condition is called atherosclerosis. Now, if let's say this atherosclerosis occurs in the arteries that supply blood and oxygen to your heart muscles, then what will happen? Due to lack of oxygen, your heart muscles will gradually become damaged. And slowly, due to the lack of blood and oxygen, they will start to die. Now, as soon as some amount of cells in the heart start to die, especially in the main pumping chamber of the heart, the left ventricle, that patient will experience a heart attack. This is medically referred to as myocardial infarction. In this condition, if doctors timely clear your blockages and restore the oxygen supply to your heart muscles, then your life can be saved. If, let's say, the patient reaches the hospital late and due to lack of oxygen. If in such cases, the large number of heart cells permanently die, then the heart cannot repair itself again. And its pumping ability will either be severely affected or it will stop functioning completely. This condition, called heart failure, this can lead to a chain reaction of triggers occurring later. Because the other organs of the body will also not get blood and oxygen, which will then make the cells of other organs in the patient also start dying rapidly. And those organs will experience a stroke, like the brain stroke, for example, a severe heart attack, or even a myocardial infarction can also be called a heart stroke. So now, in this process, where do our teeth relate with the heart attack? Or how does a heart attack connect to the teeth? If you remember, we found earlier that 78% of heart attack patients had bacteria from their teeth present in the clots. Now the question is, how did these bacteria travel such a long distance and reach the heart, and how did they settle in heart's tissues? So look at the germs in our mouth. No matter how much you brush, but over time they still find a way to persist. At least 200 distinct bacterial species are always found in our mouth. Some good bacteria are present, but some bad bacteria and our saliva constantly works to avoid damage and decay to the teeth over time. In a healthy person's mouth, good bacteria usually dominate over fewer bad bacteria. Our stomach also contains hydrochloric acid to safeguard us. This prevents harmful organisms from reaching our vital organs, but if oral health is neglected for a long time, it can lead to specific problems. If some type of foods are consumed excessively, the balance between good and bad bacteria can be disrupted, leading to gum problems. If this process of teeth damage is not reversed in time, it can result in two severe complications. One, the bacteria multiplies rapidly and it starts affecting the entire mouth. And second, it creates cavities in teeth, and through gums, it infiltrates your blood vessels. Now, let's talk about this. And it usually worsens when, let's say, you visit the dentist to address the infection. In most cases, the dentist will perform a tooth extraction and the tooth gets extracted. In such situations, these bacteria get easy access to highways of our body like veins, and they reach our vital organs with ease. But how did this problem start? What is its main root cause? So look, this is the upper surface of teeth, which is called enamel, and this is the inner layer, which is called dentin. Is mostly formed of calcium phosphate crystals called hydroxyapatite, and dentin also has a specific protein called collagen. Now when in diet, simple carbohydrates are consumed. Like sugary foods, these foods trigger our mouth bacteria to release lactic acid through the glycolytic pathway. As a byproduct, this lactic acid in your mouth, whether your teeth would decay or not, whether your heart would be affected. Let me explain to you how. The building blocks of our teeth are hydroxyapatite and collagen, both of which are made up of two acids. They erode. And this process happens when sugars like simple carbohydrates ferment in your mouth. Consider a common scenario. You drank a bottle of Coke and didn't rinse your mouth afterward. Now think about the consequences. Now, throughout the night, the sugars from the Coke will ferment in your mouth, producing lactic acid. If you continue such habits for a few days without considering your teeth, you'll regret it later. And as I said, this is very common. Basically, the production of lactic acid in your mouth increases the acidity level, which is the main reason for the decay of your teeth. Because this acidic environment kills good bacteria and helps bad bacteria like S. mutans to grow and multiply. And then these bad bacteria mix with saliva to form cavities which affect the enamel and dentin layers of our teeth. They then gain direct access to the pulp region and can penetrate nerves and neurons in the teeth. If from this pulp region they penetrate the nerves, they can reach your heart, posing a high risk. It's an expressway for them. This is the reason why so many heart attack patients have bacteria in the clots of their veins. Now, before these bacteria reach your heart, they start releasing chemicals even before that. This causes our immune system to become hyperactive and starts attacking our own tissues, which leads to the creation of dysfunctional blockages. Actually, our mouth bacteria get access to our veins. Obviously, our body's immune system will activate and respond against them. But some specific mouth bacteria, such as Tannerella forsythia and Porphyromonas gingivalis, as soon as they enter our bloodstream, they start releasing a heat shock protein, HSP60, which is almost 60% identical to human heat shock proteins. Now, heat shock proteins are proteins which our body releases during any kind of stress. They basically work on damage controlling, stress reducing, and damage fixing in the body. This means that they prevent damage and destruction when our body is internally or externally under stress. But this bacteria takes full advantage of our own problem fixer heat shock protein. How? By creating a protein similar to this heat shock protein, HSP60, and to kill them further, our body starts creating antibodies which attack our own heat shock proteins as well. Because in some of our cardiovascular areas, especially in heart patients, many HSPs are working on the protection and repair. They all start dying one by one. In our heart and the healthy tissues of the body, and similarly in the earlier cases, these bacteria are also found in the heart of the patient because they literally killed our body's soldiers' immune cells, which give extraordinary support to our body's problem fixer proteins. And our body, due to autoimmune responses, started killing heart cells. This is the reason why dentists will need to be cautious, at least in cases of heart patients, that they don't just focus on the teeth but consider the patient's case in totality. If the patient has any pre-existing heart problems, or even if they have cholesterol-related issues, then they must take precautionary measures and create a proper treatment plan. That ensures that root canals or tooth extractions do not negatively impact the patient's heart health, and they don't push any patient over the edge. But in the end, friends, our health responsibility ultimately lies in our own hands as well. Why is India a country where science is often seen as a subject, as a career, but not as a way of life, a mindset or cheat code that can empower you? Well, the day I personally realized this, it literally changed my life. Because I started seeing science as a solution to the problems in my life. Even though I am not from a science career stream, we need to understand that science is not just for doctors or engineers or scientists, it's for everyone. So now let's see how we can solve this problem at our level. Let's start from the root where these bacteria enter your body. And that is from your mouth. But even here, exactly the same mistake is happening. Well, due to lack of knowledge, we are unknowingly creating acidic environments in our mouths, which is becoming the breeding ground for bacteria. See, when there are spots like these appearing on your teeth, understand that your teeth are getting infected by Streptococcus mutans. This dangerous bacteria is there to harm. This S. mutans bacteria is different from other bacteria, and it survives in such an acidic pH environment easily. And with a special ability, it seems to dominate the environment by spreading rapidly. Its special ability is to form a sticky glucose polymer, which number one allows it to stick to teeth for a long time. And number two, this provides it with nutrition for a long time, even if you stop eating sugars in your diet. And that's why it starts accumulating in specific areas of your teeth. Then other bacteria also enter your body. So the first and most important solution is to eat sugary or high simple carbohydrate foods with meals, not in between sitting. Some studies suggest that if you continuously consume 2 grams of sucrose or table sugar daily for up to 2 years, it is okay if eaten with meals, because your saliva helps digest the food and also neutralizes the acids formed by sucrose, protecting your teeth from decay. However, consuming sucrose alone between meals can be harmful. If you consume it at night and sleep, then enough saliva is not created, which can lead to tooth decay at 3 to 4 times faster rate. So avoid eating sweets or sucrose at odd times. And if you have eaten something wrong, rinse your mouth properly or brush your teeth. Number 2, avoid soft drinks, cookies, Pepsi, or energy drinks. because these contain high sugar, which not only causes cavities but also damages the enamel, because these foods are very acidic and create an acidic environment in the mouth. This is a pH chart that shows the profile of the acidity of these drinks. In this chart, the lower the pH of the drink, the more acidic the drink is. And for comparison, the pH of our saliva ranges from 6.7 to 7, and ideally, the pH value of our entire mouth should not go below 6.3. Otherwise, an acidic environment will form. Third, chewing increases the amount of complex and thoroughly chewed hard foods. The simpler the foods you eat, the easier it becomes to digest. For these bacteria, break down your food properly, but complex carbohydrates like oats, barley, wheat are better, because bacteria cannot break them down easily. And along with this, note that hard and complex foods take more time to chew. This means that the saliva is working more to neutralize the acidity. Number 4, chewing properly is crucial. A recent experiment was conducted to demonstrate this. When some adults were given chewing gum with 6 to 7 grams of xylitol to chew every day, it was observed that their in-dental caries fell by nearly 80%. And in the saliva of those subjects, the amount of Streptococcus mutans was drastically reduced. So yes, chewing gums, especially the ones with xylitol in it, like Happy Dent, are antibacterial. And even you can use xylitol-based sweeteners in a controlled manner as a replacement for sugar. Because of this, you might even get a sweet taste initially. Secondly, you won't get extra calories, and thirdly, your mouth's environment will also remain healthy. Because in this, as we found out, there are antibacterial properties. Number 5, if you start using 5% fluoride-based toothpaste, how do these fluoride toothpaste work? Well, 2 big benefits. First, these are bacteriostatic, meaning they slow down the growth of bacteria, including S mutants, in every way. They also have remineralization agents, which are beneficial for our saliva. It means that if there is cavity or enamel erosion, it can help, it can reduce the damage, it reverses the process, deposits minerals back into the teeth, and that's why fluoride toothpaste is also a powerful tool. In the context of mouth health, these were some important tips. Now you have come to know the basic game, so much so that you can confidently find your own solutions. I'm a guide. In this video, as much as my purpose was to give you the right knowledge and solutions, somewhere it was also to create curiosity in you, that you understand the fundamentals of science and our surroundings so that you can use your creativity and say, this is how solutions can be found, which will benefit your life and your health. Science is all about creativity and creative problem solving, but it all starts from having the right knowledge of the fundamentals, which always starts from having curiosity, developing an ability to ask a question. Now, I know heart attacks are a very sensitive issue, and it is also a big killer. And behind triggering it, there isn't just one, but at least 14 factors involved, which you should fundamentally understand so that you can prevent it among your friends and family through the right knowledge. And for this, I spoke to India's renowned heart specialist, Dr. Bimal Chhajar, in a 2-hour podcast. We interviewed him, asking questions about his knowledge and experience to provide you with a clear understanding.
There are lots of jargon related to heart. Saturated, mono, unsaturated, polyunsaturated. These are all rubbish words that Indians are genetically prone to. Diabetes, cholesterol, triglycerides, blood pressure, sugar, and what is called metabolic syndrome. If you have 40% blockages, even then, you can avoid it. If you have 70% blockages, then also you can avoid it. And if you have 90% blockages, then also you can avoid it.
You have a magic diet which reduces weight. Can you please tell about the diet? Do watch the podcast by clicking on the screen. Stay fit, everyone. Keep questioning and keep learning. Jai Hind.